Up next, we're going to hear from some different experts discussing strategies for fostering a healthier, more resilient society, emphasizing the importance of collective action and public-private partnerships in this vital endeavor of revolutionizing the world of mental health. Welcome to the stage, Erica Tavares, Senior Director, U.S. Programs and Advancement at International Medical Corps, and her esteemed panel. Erica?
Thank you so much to everyone, and thank you for having us here today as we have the privilege and pleasure of really being able to build on the conversations we've been having throughout the day and really bring together a conversation around innovation, AI, mental health care. I am delighted to be here with both Brad and Jeanette. Thank you so much for joining us up here. I think it was set up fairly well in a number of previous conversations, the sort of state of the mental health care crisis in the U.S., some of the challenges that the U.S. is facing. And, I think we'll take a particular lens around children, families, and young adults as we talk about this topic. We don't have to do too much stage setting, I don't think. We have talked about it, but I think some things to note that I think can make the problem at times feel really overwhelming. 1 in 10 youth today are experiencing depression to the level that is negatively affecting their ability to function at home, at school, in work if they're working. And I think one of the things I recently read was the Surgeon General's report, the 2023 report around loneliness and the loneliness crisis in the United States, where the Surgeon General noted that the mortality impact of being socially isolated is as bad as smoking 15 cigarettes a day. And it's worse than obesity, and it's worse than the impact of a lack of physical activity. And so I think when we really think about the impact of the mental health crisis and the potential lack of resources on our youth and our children, it can, we are at a moment where there's really an opportunity for us to do much more and to really be looking at how we can innovate to improve that status. So I want to start with each of you and talk about, again, there's an enormous number of statistics out there. I don't think we have to linger on that. But when you think about mental health and in your work as you're looking at mental health, what are the indicators that you're looking at? And one, what worries you? And two, sort of how are you and your roles starting to address that? And Brad, if you don't mind, I'll start with you.
Okay, great. Hi, everybody. I'm Brad Staats. I'm a faculty at the University of North Carolina at the Business School. I'm our faculty director for the Center for the Business of Health, and I'm also our senior associate dean for strategy and academics. So manage all of our academic programs. So I can talk about it kind of in those two worlds as we think about healthcare, and we also think about our students. I think in terms of how does it resonate, I think we can look at a number of things that really shape health. Just life expectancy as a whole going down in the United States, something that just for decades we expected only to go one way with all of the miracles of modern medicine, and yet unfortunately due to suicides and the dramatic increases we've seen over the past couple of decades, as we look at drug overdose, alcoholism, and the problems that come with that, that it's really significant. I think if we look at where we're experiencing a lot of those tensions, on the healthcare side, I'd highlight things like our nurse shortages. That really coming out of COVID, we already had them, and those have only skyrocketed. And in particular at the younger ages, as folks are leaving the profession because of just how hard that has become. And I think something I'm sure we'll talk about is sort of the incivility that unfortunately is all too common. And so lots of reasons why it's a hard, exhausting, really trying job, and yet we see it's only grown harder in the last few years.
Great, thank you. And I guess, Jeanette, the same question for you. As you're thinking about what are you most worried about in this space?
Hello, I'm Jeanette Betancourt. I'm the Senior Vice President for U.S. Social Impact at Sesame Workshop. And you probably know us best as Sesame Street, but we're much more. And part of what we do also is we identify what are the greatest needs of young children. And it's really a privilege to be here because one of the elements we haven't spoken about is really early childhood. And one of the things that we look at is really what are those issues most needed for young children. And in this mental health crisis, we look at it two ways. We're looking at really from a preventive point of view, what do we do and what are the essential foundations we need to establish? But then also, how do we start to identify emotional distress early on? Suicidal ideations don't happen just at school age. There's something that happens beforehand. So from the very beginning, we looked at from the point of view of prevention. And we'll talk about really some of the essential strategies that we feel are really important in a few seconds.
We'll go right to that. I mean, I know in May, Sesame Workshop announced a multi-year initiative to really address emotional well-being of children and their families. And I think, we'd love to hear from you how and why Sesame took that on and how you're approaching it.
We took it on because we usually take on very, very tough topics and we translate them. We have a term that we say we sesamatize things. We make them easier for grown-ups and children alike. So one of the things that we started to identify was not just the mental health crisis, which was announced by several organizations in 2021, but before that, even before the pandemic, we saw the increase in distress in youth and slightly older school-age children. And we started to identify then what is most needed. And one of the gaps that we found is that there were very few resources saying to parents, to providers, what do we need to establish well-being for young children? So as an organization, we engaged in quite a bit of on-the-ground research, and we found 4 strategies that are essential for every child, no matter where they are, what their economic status is, or really in early childhood. One was emotional literacy, and being aware of one's emotions and being able to regulate. The second is the mind and body connection, which we talked about a lot today. You can't have a healthy mind without a healthy body. The other is what we call nurturing connections. Young children need an adult that is giving that sense of comfort, that sense of routine and safety. But lastly, and it's what related to actually the discussion we had beforehand, is what we call a compassionate mindset. And a compassionate mindset is the idea of setting a sense of resilience, but also joy, hope for the future, even where there's challenges. And we feel very strongly in doing that. Then we look at emotional distress. What are those tipping points in those 4 areas that start to show some levels of slight concern, not diagnosis, but early concern? Once again, social anxiety does not start in school age. There are early signs. And how do we as a nation and through Sesame Workshop's lens start to provide resources and awareness in this perspective and looking at mental health well-being as a continuum?
Thank you. And Brad, I know for college students, are you seeing this trend continue as well? And what kinds of tools and resources are you providing or being provided for students to help them address some of these challenges?
Yeah, absolutely. I mean, I think as you highlighted, right, this is something that builds over time. And I think for many of us, we reflect back on college, remember the highlights, and forget maybe some of the challenges of the academic stress that comes, the financial stress that goes with it, just the life transitions that are occurring as folks are figuring out how to be included in things and having to navigate, all of that very much real time. I think this point of it's holistic, that as we look at mental and behavioral health, it all comes together. It's health. And I think that's one of kind of the fundamental transitions that we've had of how do we think about keeping, in our case, our college students, whatever level they might be, healthy in the different aspects. And the shocks to the system are real. I'm sure many of you saw the tragedy we had on our campus a couple months ago now with the tragic murder of a faculty member with a graduate student, and then subsequently we had more gun recognition. Thankfully, didn't turn into violence there, but these shocks that are coming, and so I think a lot of it is getting ahead of it, right? I mean, we know that we need the therapy resources that are on campus, but how are we trying to create kind of that healthy environment for folks? How are we putting in kind of early respondents? I mean, I mentioned I'm in charge of academics, and I got a note from someone that 3 staff members walked somebody over today to get some help that they really desperately needed as they were in distress. And that requires looking out for folks, right? Kind of appreciating that sometimes we're going to raise our hand, and as we look at some of that increase, as we see, is people appropriately diagnosing and getting the attention they need, but other times it's we're looking out and we're building that. How do we just make sure that programming is inculcated in all aspects of life, whether it's in the dorms, whether it's in the classroom, whether it's in the activities, and investing a lot around that.
And I think a lot of what you're talking about, and a lot of what we talk about at International Medical Corps, is how do you help make individuals and families and communities more resilient to whatever crisis they might be facing, because there are a lot, and I think we've all recognized there are a number of different crises that affect people in their lives every day. I think there's a lot of opportunity there, and we've certainly heard from a lot of the panelists that have come before us about some of the innovations around providing access to care, and would love to hear from each of you how you're thinking about innovation and public-private partnership and the role that those innovations can play in providing access to students and families.
Either way, sure.
Lightest panel, yeah.
I can jump in a couple of ways. I think if we look across the state of North Carolina, this has been kind of really significant priority for Secretary Cody Kinsley, in charge of our Health and Human Services, been focused on behavioral health and doing really exciting things there. On that public-private side, we see East Carolina University and Acadia Healthcare partnering, building out a new facility down there with the Medicaid expansion, offering new services to folks. On the university side, we have an interesting partnership with Acadia where we're thinking about opioids and the addiction challenges, and how do we put together a playbook to think about kind of the funding that's out there to support local communities. And so we've been doing, kind of going through the best practices, and now we're out over the next few months in different counties across the state, understanding their unique needs. How do we put those pieces together so that we can use those funds to better support folks? There's lots more, but want to hear from...
I think I echo you. It very much for us is we are not direct service. So what we do is we develop national partnerships that go at a community level. We establish those partnerships equitably. And again, without transfer of funds, it's a commitment. And as we create our resources, we're engaging what we call a circle of care. For us, the circle of care is, here's the child in the middle, there's parents and caregivers, but who are all the other key influencers? And what we found is that it is early childhood education and the variety of programs. It's also the healthcare community, again, traditional and non-traditional, as well as those that are meeting even more distress, and such as social services. So what we try to do and innovate is, how do we message and provide these resources in professional development so they're customized to each of these different networks? And in cases, for example, we do quite a bit around parental addiction. How do we then look at that circle of care and integrate these resources not only on our emotional well-being, but also on explaining parental addiction to young children? And the reason for that is that the more we engage young children early on to understand both their hopes and joys, but also when there is distress or very tough issues, we find that that's establishing those communities of resilience, and together aligning a systematic way of approaching tough issues, but again, building resilience.
And can you talk a little bit, as you're building those communities, the role of technology or the role of AI, or the role of some of the innovations that are happening in mental health care, and how you're looking at that?
I think we're going to look at it in two ways. Right now, we as an organization, as we do with all media, is we look at what are our role, what are the benefits that we can indicate and guide around AI, early childhood, and its influence. But as we go forward, one of the incredible aspects of AI that we all heard is going to be its ability to personalize learning, personalize approaches around reaching either children or adults, and based on their issues or their stress at that point, and give that kind of response. At the other hand, there's also the idea of inequities. One statistic that seems unrelated to technology, but it shows how we're going to face inequities. In this nation, over 39% of children, every infant born, 39% of them qualify for WIC. WIC is the Supplementary Food Program, and you have to be at poverty level below. And the reason I bring that up is because already we're not working with an equal playing field. So when we're looking at technology access and these wonderful innovations that we'll be creating, I think the reason we're here is how to assure equity from the very beginning across all households. Because if we're talking about innovation and then talking about equity and starting very early on, then I don't think we'd be as effective.
Thank you. And Brad, I know I had the opportunity to and pleasure of talking with your colleague earlier today around some of the work that you all are doing related to sort of the business of health and really the lens that you look at equity through that. And so we'd love any sort of thoughts from your side around sort of this intersection of mental health and equity and technology.
Yeah, I mean, I think it's a great point. I mean, we're in an incredible space right here, but appreciating, as you're highlighting, kind of those disparities that exist, right? And, I think COVID will, for a long time, be something that we're looking back on and appreciating just how it highlighted the real challenges, right? I mean, we can take something as simple as we shifted online, and we're thinking university education, and, one might immediately, great, people are set up, but not everybody could get to, kind of good internet, and somebody's going to the parking lot somewhere and sitting in a car or on a curb as they're trying to experience class. And as we then radiate that out and we think about some of these behavioral challenges, right? Telehealth is amazing in that we can expand access, but not everybody can get there. Or as we're trying to go into the home with these different tools, that folks need help setting that up, right? Whether that's based on age, whether it's demographics, whether all sorts of things that are shaping that. And so I think part of the story here is really getting to the root cause of okay, what is that barrier? How do we, is it kind of simply operational that, we have to, in the college case, keep a dorm open, that we weren't planning on it, so that someone can be taken care of, and that happens, right? But I think, this balance between seeing the great hope of all of this, but also recognizing on the ground that there are fundamental tactical things that need attention. And fortunately, I think across this room, we're really well suited to take that on.
Mm-hmm. So you mentioned hope. So in our kind of, as we're wrapping up here, what is one thing that makes you hopeful when you think about mental health, the possibilities of technology? What are you optimistic and hopeful about as you look forward?
Sure.
I'm very hopeful that, again, we're shifting and connecting mind and body equitably. We're looking at the value that we put on physical well-being, we'll put on mental health well-being as well, and that we look at it as a continuum, not in stages. We look at prevention first as opposed to intervention.
Yeah, and I think I'd highlight two things. One is, I think breaking down the stigma, making it okay to talk about it is such a big deal that as we look across, we all raised our hands that we've been impacted some way, but have we actually shared with folks and encouraging, I see more and more leaders being willing to highlight those challenges they're having, making it okay for others to talk about it and get the care that they desperately need. I think the other piece, kind of tying the physical and the mental together, that at least to me, I think it's a radical incrementalism we're going to see to tackle this. It's not, great AI is going to solve the problem, but each little step. And it's going to be hard work, but I think we're willing to do that. And we see, the progress there. A lot further we need to go, but I see kind of the hope.
Yeah. Great. Well, thank you so much. Thank you for being here today, and thank you for doing all of that hard work.
Absolutely.
I appreciate you talking with us.
Thanks.
Thank you.